Hello, welcome to Wesson Therapeutics. I'm Belinda Wesson, co-founder and product developer for the brand. We are very excited to be sharing this product information with you today. Please be sure to follow in your product guide while you watch this video. At Wesson Therapeutics, we are really passionate about providing solutions for compromised, sensitized, as well as sensitive skin conditions. So what is the difference between these three conditions, you may ask? Well, generally speaking, a compromised skin condition results from an injury from external origin that compromises the integrity of the epidermis. For example, a graze that is caused by a cycling accident. This results in the epidermis being damaged and vulnerable to infection. A sensitized skin condition can be caused by either internal or external factors. For instance, medications such as Roaccutane or contact with harsh chemicals. Both may cause dehydration with micro cracks in the epidermis. These micro cracks allow substances such as fragrances and preservatives in skincare products to penetrate deeper into the skin than they normally would, triggering an allergic response. Let's use an example. Your client washes her hands with a fragrance soap and has never experienced any reaction. On a particular day, her hands come into contact with bleach. The skin on her hands feels dry and slightly itchy. Later that day, she washes her hands with the very same fragrance soap that she always uses, but this time her hands turn bright red and burn. This reaction to the fragrance in the soap was triggered by a chemical sensitization caused by the bleach. A sensitive skin, on the other hand, displays less severe symptoms and usually occurs through genetic predisposition. The skin is usually fair, but not always, flushes easily, and is sensitive to the sun. This type of skin condition is also sensitive to friction or heat. A sensitive skin also tends to be more prone to sensitization. Before we get started on the individual products, let's take a quick look at the history of the brand. There are two original formulations, the Resurfacing Balm and the Intensive Scar Repair. These were developed in 1995 specifically for the plastic surgery market. At the time, laser resurfacing was new technology performed exclusively by dermatologists and plastic surgeons. The lasers, such as carbon dioxide laser, were very harsh, and hence the resurfacing balm was created for a plastic surgeon in Johannesburg, who was one of the first surgeons in the country to offer laser treatment. Soon after, we began supplying another well-known plastic surgeon who opened the first dedicated laser clinic in the Cape Town's northern suburbs. Today, 25 years later, this clinic still orders resurfacing balm from us on a very regular basis. By 1998, the resurfacing balm was also being distributed to oncologists after it was found that this formulation dramatically reduced the skin sensitivity associated with cancer radiation treatment. A final year oncology student performed a double-blind study on cancer patients at Tygerberg Hospital as part of her thesis, validating the outstanding effectiveness of this formulation. For many years, the Wesson Therapeutics project was put on the back burner while we focused on another brand called Vitaderm. It was not until 2015 that the decision was made to expand the range to include a basic range of hypoallergenic, fragrance-free formulations to support the care of all types of sensitive skin. This range is now available to skincare professionals through laser clinics, medi-spas, and skincare clinics. The Wesson Therapeutics range has two distinct divisions, the therapeutic range and the complementary range. The items in the therapeutic range are those containing aromatic plant extracts as active ingredients and are utilized in the care of more serious skin afflictions. These include the resurfacing balm, the intensive scar repair, and the ozone balm. So the first item in the therapeutic range is the resurfacing balm. It is available in a 50 ml airless pump bottle, which helps to protect the product contents. In professional packaging, it is available in an economical 50 ml jar. This wax-like formulation contains plant-based oils and waxes to provide a barrier function, protecting the skin surface against the elements as well as infection. This incredibly effective balm also assists in accelerating skin healing. It helps relieve the discomfort associated with procedures such as dermabrasion, chemical peeling, laser resurfacing, and cancer radiation treatment. Other indications for use include abrasions, burns, chafing, cracked skin, dermatitis, eczema, psoriasis, vaginal thrush, insect bites, sunburn, bed sores, and excessively dry skin. Functional ingredients include grapeseed and jojoba extracts provide an emollient effect and provide the base for the plant-based waxes. These plant-based waxes are the ingredients that provide the protective film. Eucalyptus extract has an anti-inflammatory effect, while tea tree has antimicrobial benefits. Chamomile is desensitizing. Vitamin E assists in skin healing and is also added to protect the shelf life of the product. Next up is the intensive scar repair. This product is presented in a 10 ml roll-on glass bottle for retail use. The function of this product is to minimize the appearance of stretch marks and scars. Indications for use: surgical scars, acne scarring, and stretch marks. If we look at the functional ingredients, macadamia, grapeseed, and jojoba extracts have an emollient effect and are the oil-based carriers for the active ingredients, which are frankincense and lavender, both of which stimulate cellular renewal and promote healing. Here again, vitamin E is added for skin healing benefits and it protects the shelf life of the product. Let's look now at a very special formulation, the ozone balm. But first let's ask the question, what exactly is ozone? When oxygen, which is O2, comes into contact with ultraviolet light, it spontaneously splits into two single atoms and then regroups as O3, also known as activated oxygen or ozone. Breakthrough technology allows us to stabilize and infuse products with ozone. Our ozone balm is available in a 15 ml jar for retail use. The purpose of the ozone balm in skincare is twofold. Firstly, topical ozone has the ability to permeate through the epidermis to oxygenate underlying tissues and promote healing. Secondly, ozone possesses astounding antiviral, antifungal, and antibacterial properties, making the ozone balm suitable for an array of conditions. The oxygenating effect makes the following conditions highly responsive to applications of the ozone balm: bruises, joint pain, and chilblains. The antimicrobial properties, on the other hand, make the ozone balm suitable for use for the following instances: athlete's foot, nail bed infections, and ringworm. These are fungal infections. Acne eruptions, on the other hand, and other skin conditions linked to bacterial infection also respond particularly well. Shingles, cold sores, and molluscum, these are viral infections of the skin. As far as the functional ingredients are concerned, activated oxygen or ozone is the main ingredient. Jojoba and macadamia extracts form the carrier of the ozone, while plant-based waxes help to protect the skin. Vitamin E is added, once again, to protect the shelf life of the product. In the next video, we'll take a look at the complementary range. Thank you for watching.